The worst medication that clogs your arteries while you sleep. Do you take medications at night thinking you're taking care of yourself? What if I told you that, while you sleep, you might be clogging your arteries without knowing it? Yes, this is real, and it could be happening to you right now. Some of the most common medications hide side effects that directly affect the heart, blood vessels, and blood pressure. In this video, I'm going to reveal the 15 most dangerous medications for your arteries, and the worst part, many of them are sold over the counter, and you might be using them without knowing the risks. If you want to know what these medications are, come with me. Number 15. Naproxen. Naproxen is a non-steroidal anti-inflammatory drug, or simply NSAID, widely used to relieve joint, muscle pain, and cramps. But what many overlook is the silent impact it can have on the cardiovascular system. Behind the quick relief, there's a serious risk: fluid retention, increased blood pressure, and heart strain. These side effects are not rare, especially in those already predisposed to heart disease. When the body retains fluids, blood circulates with more difficulty, requiring more effort from the arteries. Have you ever imagined that a simple back pain pill could harm your circulation during sleep? That's exactly what can happen with continuous use of naproxen. At night, metabolism slows down and fluid retention intensifies, increasing blood pressure. This forces the arteries to remain under constant strain, raising the risk of ruptures and vascular inflammation. What should be a recovery period becomes a dangerous time for your cardiovascular system. The situation worsens when naproxen is used without medical supervision, which is quite common. Many people turn to it on their own to treat recurrent pains, unaware that prolonged use can be harmful. The problem intensifies in the elderly, who already have a higher tendency for fluid retention and pressure fluctuations. The constant overload of the arteries, especially at night, increases the risk of heart attack and stroke. And don't think these effects are rare or exaggerated. Studies have shown that chronic use of NSAIDs like naproxen can alter endothelial function, compromising the flexibility of the arteries. This means that blood vessels lose their ability to relax and contract properly, contributing to the formation of fat plaques. While sleeping, the body should be reducing pressure and recovering tissues, but this process is interrupted by substances like naproxen. In the long run, this can represent a direct path to cardiac complications. Number 14. Diclofenac. Diclofenac is one of the most used anti-inflammatories in the world, present in treatments for muscle pain, joint pain, and even acute inflammations. However, what few know is that it is also among the most dangerous medications for the heart. Its frequent use has been associated with a significantly elevated risk of cardiovascular events. This includes heart attacks, thromboses, and even sudden death, especially in patients with a genetic predisposition or a history of heart diseases. And the most frightening, this risk intensifies during nighttime rest. During sleep, the body should be in a state of recovery and regeneration, but diclofenac can reverse this process. It negatively affects the endothelium, which is the inner layer of the arteries, reducing its ability to dilate. This makes the blood encounter more resistance to circulate, increasing pressure and favoring the accumulation of fat plaques. This means that taking diclofenac routinely could be sabotaging the health of your arteries every night. Another critical point is that diclofenac interferes with kidney function, which directly affects the balance of sodium and water in the body. The resulting fluid retention can be disastrous for those with hypertension. This excess fluid increases the blood volume, overloading the heart and favoring ruptures in already weakened vessels. It's no coincidence that health regulatory bodies have warned about the risks of this medication. Its indiscriminate use is among the leading preventable causes of cardiac complications. Clinical studies have revealed that the risk of cardiovascular events with diclofenac may be comparable or even superior to some medications already withdrawn from the market due to their adverse effects. Even in doses considered safe, side effects can arise silently. Therefore, self-medication with this drug represents an even greater danger. It's common for people to use diclofenac for consecutive days for chronic pains without realizing the cumulative impact on the cardiovascular system. This is a mistake that could cost dearly to your heart's health. In addition to the heart, diclofenac can affect the gastrointestinal tract and the kidneys, creating a cascade of problems that require vigilance. When used before sleeping, the body absorbs its effects while in rest mode, which reduces the ability to respond quickly to imbalances. This is especially dangerous in the elderly, whose metabolism is already slower. The risk of a nocturnal cardiac event is real and underestimated. If you suffer from chronic pains, it's better to seek alternative solutions that preserve your vascular health. Number 13. Pseudoephedrine. Pseudoephedrine is a nasal decongestant found in many popular remedies, such as 𝙤𝙤𝙤𝙤𝙤 and 𝙤𝙤𝙤𝙤𝙤. Its purpose is to relieve nasal congestion, allowing for freer breathing, especially at night. However, this relief may come at a high cost for those with cardiovascular problems. Pseudoephedrine acts by causing vasoconstriction, that is, it contracts the blood vessels to reduce nasal swelling. But what happens when this contraction also affects your coronary arteries? During rest, the body naturally slows down to promote relaxation of the heart and vessels. When you take a medication with pseudoephedrine before sleeping, this logic is disrupted. The generalized vasoconstriction increases vascular resistance, dangerously elevating blood pressure. The heart needs to work harder to pump blood, which can result in overload and even arrhythmias. In people with a history of hypertension or heart diseases, the use of this type of medication should be cautious. Even in healthy individuals, its continuous use can affect vascular tone and cause discomforts, such as nocturnal palpitations. These side effects are often ignored or mistaken for anxiety. In the long run, the impact on the cardiovascular system can accumulate, leading to the formation of atherosclerotic plaques. Small choices like this, repeated frequently, make a huge difference. Another alarming point is self-medication. Many consumers use decongestants with pseudoephedrine every day, without any medical guidance. The recurrent and prolonged use can cause physiological resistance, making the body need increasingly larger doses for the same effect. This further aggravates the cardiac risks. The habit of dropping the nose before sleeping may be secretly increasing the pressure of your circulatory system night after night. It's not about demonizing decongestants, but understanding their real effects. There are natural and safe alternatives, such as inhalations with physiological serum or specific essential oils. In addition, in many cases, nasal congestion is a result of allergies that can be controlled by other means. Number 12. Pantoprazole. Pantoprazole belongs to the same class as omeprazole. It's a proton pump inhibitor used to control the production of acid in the stomach. Although effective in relieving symptoms of reflux and gastritis, its continuous use brings risks often ignored. Like omeprazole, pantoprazole impairs the absorption of essential nutrients for the heart, such as magnesium, iron, calcium, and vitamin B12. This creates an environment conducive to weakening the cardiovascular system. And the most concerning, the effects are progressive and silent. Magnesium deficiency, for example, is one of the most common consequences of prolonged use of pantoprazole. This mineral is crucial for regulating blood pressure, the electrical conduction of the heart, and the integrity of blood vessels. When its levels are low, the risk of arrhythmias, vascular spasms, and high blood pressure increases. In addition, the poor absorption of vitamin B12, caused by the continuous use of pantoprazole, directly affects the metabolism of homocysteine. High levels of this substance in the blood are toxic to the endothelium of the arteries and favor the formation of fat plaques. This raises the risk of heart attacks and strokes, especially during sleep, when the body should be recovering. Nighttime use, being continuous, intensifies the metabolic impacts. Many patients do not even undergo tests to monitor these deficiencies. Another problem is that pantoprazole can affect kidney function in the long term. And when the kidneys don't work well, the heart also suffers. The accumulation of sodium, fluids, and toxins increases blood pressure and further strains the arteries. This contributes to the loss of vessel elasticity and favors severe cardiovascular complications. The false sense that a stomach medicine is harmless may be putting your entire circulatory system at risk. Number 11. Loratadine. Loratadine is a very common antiallergic used to relieve symptoms such as sneezing, itching, rhinitis, and urticaria. Its effect is considered mild compared to other antiallergics, which is why it is widely prescribed and even used without a medical prescription. But what few know is that, even though it is considered safe, loratadine can significantly affect the cardiovascular system in some people. This impact is especially concerning when the medication is used before sleeping. In sensitive individuals, or those already using other medications, loratadine can cause changes in heart rhythm. Although these effects are rare, they become more likely with the combined use of other drugs that affect the central nervous system or the heart. At night, the risk is amplified by the natural drop in heart rate during sleep. The interference of loratadine in this process can lead to arrhythmias and episodes of silent tachycardia. The combination with alcohol, caffeine, or other vasoconstrictor medications can intensify these adverse effects. The body at rest is more vulnerable to changes in the electrical conduction of the heart. For elderly people, or those with a history of heart diseases, this risk is even higher. Even if loratadine seems harmless, its impact can be real, silent, and cumulative. It's important to remember that anti-allergic medications interfere with histamine receptors that also affect the cardiovascular system. Another point of attention is the chronic use of loratadine. Although many people use the medicine only during allergy crises, others incorporate it into their daily routine, including nighttime. This practice can expose the body to unnecessary pharmacological burden, making it difficult for the nervous and cardiovascular systems to fully rest. The body needs calm nights to regenerate, and not chemical interferences that destabilize its cardiac function. Don't underestimate the side effects just because they are not immediate. The good news is that there are natural alternatives for allergy control, such as using air filters, adjusting the diet, and supplements like quercetin. For those who need anti-allergics daily, it is essential to talk to a doctor to evaluate the possibility of medications with less cardiovascular impact. In many cases, a small change in approach can bring significant results. Respiratory health does not need to mean a risk to the heart. Number 10. Diphenhydramine. Diphenhydramine, present in medications like Benadryl and similar, is an anti-allergic with a sedative action well known for its calming effects. Many people use it to sleep better, relieving symptoms of allergy or occasional insomnia. However, this apparent tranquility hides significant dangers for the heart. Diphenhydramine can affect the electrical conduction of the heart, causing changes in heart rhythm, especially in more sensitive people. And this happens just when the body should be in full rest. During sleep, the sedative action of diphenhydramine interferes with the natural physiological rhythms of the body. In some cases, it can cause very low heart rate or tachycardia, which is a very high frequency, creating dangerous imbalances. In addition, urinary retention, another common side effect, can cause discomfort and pressure on the bladder, making continuous and restorative sleep difficult. A medication that should help you sleep can end up harming the functioning of the cardiovascular system during the night. The situation worsens with continuous use or in combination with other drugs. People who take antidepressants, anxiolytics, or medications for hypertension may suffer negative interactions when adding diphenhydramine to their nighttime routine. This can lead to unwanted fluctuations in blood pressure as well as irregularities in heartbeats. The problem is that these signs often go unnoticed, being attributed to stress or fatigue. Another important point is the use of diphenhydramine in the elderly. In this age group, the risks are even higher. The combination of reduced liver metabolization capacity and increased sensitivity of the central nervous system makes the action of the medication more intense. In addition to the effects on the heart, there is a risk of mental confusion, nocturnal falls, and delusions, especially after prolonged use. That's why experts do not recommend the use of this type of anti-allergic for older people. Number 9. Amitriptyline. Amitriptyline is a tricyclic antidepressant that is also used to treat chronic pain, insomnia, and migraine. Despite its therapeutic efficacy, it can bring serious side effects to the cardiovascular system, especially when used at night. Amitriptyline directly interferes with the electrical conduction of the heart, which can result in dangerous arrhythmias. This risk is higher during sleep, when the body enters a state of deep relaxation and natural vigilance is reduced. The mechanism of action of amitriptyline involves the modulation of neurotransmitters such as serotonin and noradrenaline, which also influence heart rate and blood pressure. This can generate dangerous imbalances such as nighttime blood pressure peaks or irregular heartbeats. In individuals with a genetic predisposition or a history of heart problems, these effects are even more pronounced. In addition, amitriptyline can cause excessive sedation, which leads to a reduction in respiratory tone and an increased risk of sleep apnea. This condition, in turn, further aggravates cardiovascular health, as it interrupts the supply of oxygen to the heart during the night. The lack of adequate oxygenation increases the risk of silent heart attacks and fatal arrhythmias. This creates a dangerous cycle. The medication used to improve sleep, in fact, compromises deep rest and the health of the arteries. In elderly patients, amitriptyline represents an even greater risk. The metabolization of the medication is slower, and the side effects accumulate in the body. In addition to cardiac risk, there may be mental confusion, dizziness, and falls, especially during nocturnal trips to the bathroom. The sum of these risks can be catastrophic. That's why the choice for this medication should always be carefully evaluated, and preferably for a limited time. Another critical factor is drug interaction. Amitriptyline can enhance the effects of other cardiovascular medications or even cancel them out, depending on the combination. This deregulates the treatment of hypertension, dyslipidemia, or arrhythmias, compromising the body's balance. And since the effects are subtle and slow, they are often only noticed when it's too late. Prevention is always the best path. Number 8. Fluoxetine. Fluoxetine is a selective serotonin reuptake inhibitor antidepressant, widely used in the treatment of depression, anxiety, and obsessive disorders. Despite being considered safe and well-tolerated, it is not free from dangerous side effects, especially for the heart. One of the most worrying risks is the impact on blood clotting, in addition to the possibility of altering heart rate. These effects may go unnoticed, but they are potentially serious, especially during sleep. Fluoxetine interferes with blood platelets, reducing their ability to aggregate. This can increase the risk of bleeding and, paradoxically, is also associated with changes in clot formation. In people predisposed to heart diseases, this imbalance in clotting can be a risk factor for strokes and thromboses. During nighttime rest, when circulation is naturally slower, this risk becomes even more relevant. Another aspect is that fluoxetine can cause prolongation of the QT interval on the electrocardiogram, which increases the chance of dangerous arrhythmias. This change in the electrical conduction of the heart, although rare, is potentially fatal, especially in patients who combine fluoxetine with other medications. It is during sleep that this type of arrhythmia can arise without any prior warning. In addition, the use of fluoxetine for extended periods can affect blood pressure balance. Although often subtle, this effect can worsen over time, especially in the elderly or people with a history of hypertension. Fluoxetine can also interfere with sleep quality, altering REM cycles and making deep rest difficult. This directly impacts the cardiovascular system, which depends on a restorative night to maintain balance. It is important to remember that fluoxetine, like any antidepressant, should be administered with continuous monitoring. Its effects on the body are broad, and the heart is not immune to these influences. Even if the benefits for mental health are evident, it is essential to continually evaluate the possible side effects. A simple cardiological evaluation can make all the difference. Therefore, if you use fluoxetine or are considering starting this treatment, talk to your doctor about the risks and the need for cardiac monitoring. Number 7. Metformin. Metformin is one of the most widely used medications in the world for controlling type 2 diabetes. It helps reduce glucose production by the liver and increases insulin sensitivity. Although extremely effective in glycemic control, this medication can present significant risks for cardiovascular health, especially in people with compromised renal function. One of the most feared side effects is lactic acidosis, a serious condition that can compromise heart function. During sleep, metabolism slows down and the body enters a state of deep rest. If there is an accumulation of metformin in the body, which can occur in patients with reduced renal function, the risk of lactic acidosis increases significantly. This metabolic imbalance causes a drop in blood pressure, muscle weakness, and changes in heart function. What seems like a peaceful night may hide a silent threat, manifested through subtle changes in heart rhythm or blood oxygenation. In addition, metformin can interact with other common medications such as diuretics, ACE inhibitors, or anti-inflammatories, intensifying their adverse effects. Especially during the night, these interactions can cause dehydration, hypotension, and excessive strain on the heart. Another factor that deserves attention is the deficiency of vitamin B12, common in chronic users of metformin. The lack of B12 is linked to neurological symptoms, fatigue, and increased levels of homocysteine, a substance associated with cardiovascular risk. The combination of poor oxygenation, nutritional deficiency, and renal overload is especially dangerous at night. This is the time when the body needs to repair itself, not face more challenges. Therefore, the use of metformin requires frequent monitoring of renal function, B12 levels, and overall cardiovascular health. Periodic tests and dose adjustments are essential to ensure safe use. In many cases, measures such as changes in diet, physical activity, and supplementation can reduce the need for medication or minimize its side effects. Number 6. Levothyroxine. Levothyroxine is widely used in the treatment of hypothyroidism, a common condition especially among women and the elderly. It is a synthetic thyroid hormone that, when used correctly, helps regulate metabolism, energy levels, and even body temperature. However, when poorly dosed, particularly in high amounts, it can become an enemy of the heart. This occurs because excess levothyroxine accelerates metabolism excessively. The most direct result is tachycardia. The heart starts to beat faster than necessary, even at rest. During sleep, this poses an even greater risk, as the body should be slowing down. In addition, this state of hyperactivity, induced by levothyroxine, can cause chest pain, arrhythmias, and in more severe cases, heart failure. For those already predisposed, the danger is even more pronounced. Another critical point is that many people use levothyroxine for weight loss, even without a diagnosis of hypothyroidism. This practice is extremely dangerous and can lead to heart overload, muscle mass loss, and severe hormonal deregulation. Even with quick results on the scale, the cost to the cardiovascular system can be extremely high. In the elderly, the improper use of levothyroxine is even more concerning. Aging reduces the heart's capacity to adapt to hormonal stimuli. A dose slightly above what is needed can cause rhythm disorders, hypertension, and even falls due to dizziness. The increased sensitivity requires constant and careful adjustments. Therefore, frequent tests are indispensable to maintain the safety of the treatment. In addition to cardiac risks, excess levothyroxine can also cause insomnia, anxiety, and calcium loss in bones, directly affecting overall health. All of this contributes to the body's wear, especially when these effects silently accumulate during the night. What should be a restorative medication can transform into a source of invisible metabolic stress. Number 5. Ranitidine. For many years, ranitidine was one of the most popular medications for treating heartburn, reflux, and ulcers. It worked by reducing stomach acid production, offering almost immediate relief. However, its use was suspended in several countries after studies indicated possible links to substances potentially carcinogenic. In addition, ranitidine also has a history of cardiac side effects that, until recently, went unnoticed. A clear example of how a common medication can become a hidden risk. Among the observed adverse effects are bradycardia and arrhythmias, especially in patients with pre-existing heart problems. During sleep, these effects are even more concerning. The nighttime metabolic slowdown combined with the action of ranitidine can lead to a sharp drop in heart rate. Another problem associated with ranitidine was its ability to alter the body's electrolyte balance, particularly potassium and magnesium levels. These minerals are essential for the electrical conduction of the heart. When they are out of balance, the risks of arrhythmias and irregular heart contractions increase. The danger increases during the night, when the body is more vulnerable to these fluctuations. This shows how the impact of a medication can go far beyond what is expected. In addition to direct effects, ranitidine interacted with other common medications, such as anticoagulants and blood pressure drugs. These interactions increase the risks of bleeding or hemodynamic instability, which is critical for elderly patients or those with heart diseases. The combination of these actions put the cardiovascular system in a state of constant alert, even during rest. Sleeping without knowing that the heart is fighting against internal chemical reactions is an alarming scenario. It is important to remember that the risk of ranitidine was not only in its direct effect, but also in the contaminants found in several brands. The presence of NDMA, a potentially carcinogenic substance, was decisive for its withdrawal from the market in several countries. This episode reinforces the importance of always reviewing what we use daily, even if it seems harmless. Number 4. Excessive calcium supplements. Calcium supplements are widely used, especially by people concerned about bone health. Their consumption is often recommended to prevent osteoporosis and strengthen bones, especially in the elderly. However, what many ignore is that calcium, when consumed excessively or without proper medical guidance, can become a silent enemy of the cardiovascular system. This happens because excess calcium in the blood can be deposited in the arteries, favoring their calcification. Arterial calcification is a dangerous process. It reduces the flexibility of blood vessels, making it difficult for blood to pass, and increasing the risk of hypertension, heart attack, and stroke. During sleep, when circulation naturally slows down, this arterial stiffening becomes even more critical. The heart needs to work harder to maintain blood flow, which can lead to overload and, over time, to heart failure. Another common mistake is consuming calcium without the proper balance with vitamin K2. This vitamin is essential for directing calcium to the bones, preventing it from being deposited in the arteries. Without it, the body does not know exactly where to store the mineral, increasing the risk of vascular calcification. This crucial detail is often overlooked both by those who consume the supplements and by those who recommend them. And at night, when the body works on cellular regeneration, this imbalance can be even more harmful. In addition, the consumption of calcium without prior evaluation of blood levels can cause hypercalcemia, a condition that alters heart rhythm, causes nausea, muscle weakness, and mental confusion. These symptoms, if ignored, can evolve into serious complications. The problem is that many believe that because it is a supplement, the risk is lower. But it's not like that. In high doses, calcium has effects comparable to those of medications with intense action on the heart. In the elderly, this risk is even greater as the metabolism no longer responds in the same way, and the kidneys, responsible for eliminating excess calcium, may be compromised. This makes supplementation a risk factor for cardiac events, especially at night. An innocuous supplement can become a trigger for serious problems during sleep. Therefore, the use of calcium should always be guided by tests and monitored by a professional. Number 3. Cortisone and Prednisone. Cortisone and prednisone are powerful oral corticosteroids, often used to treat inflammations, autoimmune diseases, severe allergies, and respiratory problems. Despite their efficacy, these medications carry a series of important side effects, and the cardiovascular system is one of the most impacted. Prolonged use or in high doses can lead to increased blood pressure, sodium retention, elevated cholesterol levels, and consequently, a higher risk of heart diseases. During the night, when the body undergoes a regeneration process, the use of corticosteroids can negatively interfere with this cycle. They increase the release of cortisol, the stress hormone, even during hours when the body should be resting. This causes a constant state of alert, preventing the natural reduction of blood pressure and heart rate. Another significant impact is the retention of fluids and sodium, which contributes to increased blood volume and pressure within the vessels. Over time, this excess pressure damages the arterial walls, favoring the formation of fat plaques and calcification. High nighttime blood pressure is especially dangerous because it occurs away from the watchful eyes of doctors or measuring devices. And the risk of a nighttime heart attack is real, especially in older people or those with a family history of heart diseases. In addition, corticosteroids raise cholesterol and triglyceride levels, profoundly altering the patient's lipid profile. High cholesterol combined with increased pressure and constant inflammation creates the perfect scenario for artery obstruction. This affects both the heart's arteries and the brain's, increasing the risk of silent strokes. Sleeping with an inflamed and pressured vascular system is a ticking time bomb that can explode at any moment. Mental health is also impacted. The continuous use of corticosteroids is linked to insomnia, agitation, and even depression. Poor quality sleep, in turn, worsens cardiac risks, creating a vicious cycle. People who use prednisone or cortisone often report extreme fatigue, chest pain, and palpitations, but often do not associate these symptoms with the medication. Therefore, if you need to use corticosteroids, always do so with rigorous medical supervision. Number 2. Finasteride. Finasteride is a medication widely used by men to treat hair loss and benign prostatic hyperplasia. Its mechanism of action involves the inhibition of the enzyme 5-alpha reductase, reducing the levels of the hormone DHT. However, this seemingly localized hormonal modulation can have significant systemic effects, including on the cardiovascular system. One of the main risks is interference with blood pressure and the function of blood vessels. Recent studies indicate that finasteride may affect the production of nitric oxide, an essential compound for the dilation of blood vessels. With less nitric oxide, the arteries become more rigid, which raises blood pressure and makes circulation difficult. During sleep, when the body should relax, this vascular rigidity creates a stressful environment for the heart. What should be a cosmetic treatment might end up silently harming the circulatory system. Another point of attention is reports of adverse effects such as palpitations, fatigue, and unstable pressure, especially in men sensitive to the medication. These symptoms, although rare, are enough to raise concerns in those with a predisposition to heart problems. The risk increases when finasteride is combined with other medications that also affect pressure, such as diuretics or beta blockers. Besides cardiovascular impacts, finasteride can affect lipid metabolism and hormonal levels, altering the balance between testosterone, DHT, and estrogen. These hormonal changes have direct effects on vascular tone and cardiac function. Older men, in particular, are more susceptible to these changes and may develop subtle symptoms that go unnoticed. And at night, these effects are amplified by the lack of physical activity and the body's low response to internal stresses. It is important to note that, despite being widely used, finasteride is not without risks. Its use should always be evaluated considering the patient's health background, including family history of cardiovascular diseases. The desire for stronger hair cannot justify a silent overload on the circulatory system. If there are symptoms like unexplained fatigue, chest pain, or changes in heart rhythm, it's time to investigate further. Therefore, before starting or continuing the use of finasteride, talk to your doctor about all possible side effects. Number 1. Isotretinoin. Isotretinoin, commercially known as Roaccutane, is widely used in the treatment of severe acne. It is one of the most effective medications against resistant pimples, but also one of the most potent and with the greatest potential for side effects. What few know is that in addition to dermatological and psychological impacts, isotretinoin can directly influence cardiovascular health. And these effects often manifest silently, especially during sleep. Among the main risks is the alteration in cholesterol and triglyceride levels. Isotretinoin significantly increases these fats in the blood, favoring the accumulation of plaques in the arteries. During nighttime rest, this buildup can compromise blood flow, requiring more effort from the heart. In predisposed individuals, this scenario translates into a higher risk of atherosclerosis, heart attack, and high blood pressure. Another critical effect of isotretinoin is hepatic inflammation, which affects lipid metabolism and compromises toxin elimination. An overloaded liver cannot properly process lipids, which further worsens the lipid profile in the blood. At night, when the body works to detoxify, this impaired function represents a real danger to the cardiovascular system. The arteries become easy targets for inflammations and fat deposits, accelerating vascular aging. In addition, isotretinoin can interfere with hormone production and the overall balance of the body. In some cases, changes in blood pressure and heart rhythm have been reported, symptoms that may be ignored or associated with other causes. This side effect is even more concerning in young people who use the medication without proper monitoring. Many take the drug for long periods without checking the health of their arteries. The use without prescription and the sharing of capsules are also common practices that increase the risk of complications. Even though it is a controlled medication, there are still cases where its use is done without periodic tests or precise guidance. This can put at risk not only skin health, but also the integrity of the heart. Therefore, the use of isotretinoin should always be done with rigorous medical supervision. And if you want to continue receiving the best videos for your health, subscribe to the channel because it only exists for one reason: to make you a healthier person with more quality of life. Helping you is my mission. In the video that now appears on your screen, I reveal the leaf capable of destroying diabetes, bad cholesterol, high fat, and inflammations in your body. Click on the screen and check it out. So, see you in the next video.